This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube, and the audio is available on WisconsinEye. Before opening remarks and your questions, a reminder to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Ebers, DHS Secretary-Designee Andrea Palm, and Sara, a nurse with the UW Health COVID-19 unit. Also available to answer questions, Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Ebers.
Good afternoon, everybody, and thanks for joining us today. Earlier this week, we announced a new order that allowed us to turn the dial another notch by allowing non-essential businesses to do more than they were able to do before. These changes went into effect today, which is good news for many families and small businesses across our state. Under our Safer at Home order, every business across our state can do things like deliveries, mails, curbside pickup, and curbside drop-off. So, for example, whether you're an upholsterer, a taxidermist, a dog groomer, or you rent recreational equipment like kayaks, paddle boats, or canoes, you'll be able to provide some of those services under the Safer at Home order. And yesterday, we announced that the Wisconsin Department of Natural Resources will be reopening 34 of our state parks, forests, and recreational areas that were closed earlier this month due to unprecedented crowds and out of an abundance of caution to protect public health. The First Lady and I are both very happy about this announcement. The decision to close some of our parks was a tough one for me personally, but it was the right thing to do at the time to keep people safe. Wisconsin was among 21 other states, including our neighbors in Ohio, Michigan, and Illinois, in making the decision to close some or even all state parks. But now we're able to turn the dial to reopen most of our parks. That's good news because outdoor recreation is important for both physical and mental health, and I know how important it is to Wisconsinites to get outside and enjoy Wisconsin's natural resources and spring weather. We want to be able to keep our parks open, so we still will need everyone to do their part by practicing social distancing and staying close to home and their community. You know, we get a lot of questions about what close to home means. This is a place where we need folks to use their best judgment with an eye towards being cautious. When you think about your community and where to travel for recreation, think about things like where your kids go to school, where you do your grocery shopping, and where your place of worship is. Then try to stay within these general areas. These kinds of common sense we must make in order to slow the spread of COVID-19. Between these measures and a few adjustments like closing one day a week for maintenance and reduced hours of operation, we should be able to get outside and enjoy our parks safely and respectfully. Hopefully the weather will start cooperating soon so folks can get outside and enjoy state parks starting this Friday, May 1st. Now, as we continue planning our next steps, it's not without some uncertainty. You've heard me say many times that this virus sets our timeline, and we have to approach this like turning a dial, not flipping a switch. Believe me, I understand that is a frustrating answer. Small businesses can't operate on hypotheticals. Workers can't pay their rent with the promise of a future economic recovery. There is nothing I would love more than to provide some certainty on when we can open up more of our economy. While we can't control this virus, we can control how the state responds to it. And what we need is a unified, bipartisan approach. I look to our neighbors in Ohio, where Democrats in the legislature are working with Republican Governor Mike DeWine, or to Minnesota, where Republicans in the legislature worked with Democratic Governor Tim Walz to pass multiple pieces of bipartisan legislation. So I know it's possible here in Wisconsin, but it takes a cooperation and a willingness to work together. Not a partisan lawsuit that puts people's lives at risk. Safer at home is working. It is saving lives. It is the best and most effective tool we have to save lives and prevent our hospitals from being overrun. That is why my administration has asked the Wisconsin Supreme Court to toss the lawsuit that legislative Republicans filed to take away Safer at Home. Wisconsin's pandemic laws give DHS broad powers to implement all emergency measures necessary to control communicable diseases like the devastating one we are now faced with. Every other state has similar laws, which were passed in response to frequent outbreaks of communicable diseases in the early 20th century. Wisconsin is one of at least 42 states that have used these laws to quickly combat and contain COVID-19 with safer at home measures. Instead of having Wisconsin quickly respond to the pandemic and to save lives, the Republican lawsuit asked the Wisconsin Supreme Court to block the Safer at Home and have DHS go through a lengthy administrative rulemaking process. Deadly viruses don't wait around while bureaucrats and politicians jump through procedural hoops. An effective response requires swift action by public health experts, which is why state law gives DHS the power to act quickly to stop the pandemic and save lives. I'm ready to put this silly lawsuit behind us and work together. I'm calling on Republicans to join me in doing what's right to ensure public safety. This virus has killed more than 300 of our family members, friends, and neighbors. Thousands more are sick. Tens of thousands are experiencing economic uncertainty. People in this state are scared, and they want us to do everything we can to keep them safe. No one understands this devastation and fear more than our healthcare workforce. I continue to be blown away by the response of our healthcare workers and caregivers, whether it's our public health workers on the front lines working to stop the spread of the disease, our medical lab professionals processing COVID-19 tests 24/7, or retired healthcare workers stepping up to volunteer. We are seeing folks serve a cause greater than themselves. I'm especially grateful for the selflessness, empathy, and sacrifice of our nurses. In these challenging and unprecedented times, nurses continue to rise to the occasion, providing comfort and care to those who are experiencing their darkest days. Given the danger of spreading COVID-19, patients are often isolated from their families and friends. Nurses might be the only people who have direct contact with a patient, making them a true lifeline for patients who are lonely, sick, and scared. Can't say enough to thank our nurses and the rest of our healthcare workforce for their willingness to heed the call of our families, neighbors, and communities during this crisis. We find hope, unity, and strength in your service. And now, before Secretary-Designee Andrea Palm gives her daily update, I'd like to let all of you hear directly from Sara Schoen, one of the nurses on the front lines of this crisis. Sara?
Thank you. I'd like to share a little bit about what it feels like on a hospital unit caring for patients who have COVID. Being in the hospital on a unit caring for patients with COVID is incredibly isolating. It's very isolating first for the patients. These patients only see their nurse or nursing assistant for the most part because they're the only people generally who are entering their room. These staff members additionally are wearing significant amounts of PPE, so it's very challenging for the patients to even recognize the caregivers that are caring for them. They have no friends visiting, they have no family visiting, and their only contact with their family or friends is through a phone or a tablet. Some patients are here for a few days, and some are here for a few weeks, and they are isolated the entire time. We do that in an effort to protect the rest of the patients and our staff in the hospital so that the building remains safe for everybody who needs to be here, but it's very isolating for those patients. Additionally, it's isolating for our staff. The nurses and nursing assistants are generally the only ones going into these rooms of these patients. So they're doing all of the duties that they used to have support from other staff members to do, such as cleaning patient rooms, drawing labs, delivering food trays, for example. The stressors for these staff members are huge. Patients with COVID-19 can get sick very quickly. The nurses are trying to care for these patients while also going into the room as few times as possible. And they're not able to have the door open, so they can't see their patients from outside of the room. So they're not able to do the monitoring that they're used to be doing. The staff are also concerned about taking the virus home. They're taking off scrubs or any clothing that was worn to the hospital before they even enter their houses. They can't hug their kids as their kids run to them to give them a hug after their day of work. They have to head straight for the shower. That's very, very challenging. This has been going on for 6 weeks, and we don't have an end date right now, which is even more challenging for the staff. They've really risen to this challenge, but it is a challenge. Stay at home because it feels so isolating. But this virus is very contagious, and it is so much more isolating being in the hospital. So we need to stay home to help stop the spread. Thank you for your support of healthcare workers, and now I'll send it back to Secretary Palm.
Thank you, Sara. Good afternoon, everyone, and thanks again for joining us today. On Monday, we announced our new Badger Bounce Back dashboard to track our progress towards the Wisconsin gating criteria. We're dedicated to making policy decisions based on data and science and committed to sharing that data with you. And so here's where things stand today. We have 50 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 11,047 tests. We have 66,630 negative tests, which is an increase of 3,095 tests over yesterday. There are now 6,520 confirmed cases of COVID-19 in Wisconsin, which is an increase of 231 over yesterday. Our total deaths here in Wisconsin have now reached 308. These numbers give us a daily general snapshot of the state of COVID-19 in Wisconsin, but it is not detailed enough to really tell the story of the pandemic in our state. That is why we are announcing today a new data page on our website. This page is dedicated to tracking facility-based outbreaks and investigations here in Wisconsin. Let me be clear. Every positive test of COVID-19 begins a case investigation with contact tracing. However, positive tests can also trigger a facility-wide investigation depending on the location of those positive tests. For example, a single positive test in a long-term care facility, such as a nursing home, indicates the need for a facility-wide investigation. The same is true for 2 or more cases in a group housing facility such as a jail or a prison, or a healthcare facility such as a clinic or a dialysis center, a workplace such as a factory or another indoor space such as a child care center. Wisconsin currently has 187 facility-based outbreaks and investigations. 93 of these are in long-term care facilities, 48 in workplace settings, 25 in group housing, 11 in healthcare facilities, and 10 in other types of facility settings. The webpage we are launching today will break this data down by setting as well as by region. Tracking the prevalence and locations of outbreaks and investigations in Wisconsin is integral to our Badger Bounce Back plan. We want to share this information so that you can see the challenges facing our communities and our state as a whole and understand how that is informing our policy decisions. In addition to our public health challenges, we know there are economic hardships caused by the COVID-19 pandemic that have reduced access to nutritious food for families. During the school year, over 400,000 students in Wisconsin receive free or reduced price lunches. Because schools are currently closed, many of these students are unable to access that food. We know many districts and community organizations are working tirelessly to help get critical nutrition to these children, and we are happy to announce today that more help is available to these families. Through funding from the Federal Families First Coronavirus Response Act, DHS will provide over $140 million in food benefits for families with children who receive free or reduced price lunches during the normal school year. These funds will be available through the first part of June. Families already enrolled in state benefits will receive the funding on their Quest cards or a dedicated pandemic EBT card. Families whose children receive free or reduced price lunches but who are not enrolled in state benefits will need to apply separately. And we at DHS are partnering with the Department of Public Instruction to contact these families so they know that they are eligible. We know that students need nutritious food to learn, and while in-person schooling has stopped, learning has not. And that is why the pandemic EBT program is so important. The COVID-19 pandemic continues to challenge us as a state, and you, the residents of Wisconsin, continue to rise to that challenge. Thank you for all the work you are doing, staying safer at home, so that we can do the important work of bouncing back as a state.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter per media outlet. We'll begin today with Scott Bauer from the Associated Press. Scott?
Hi. Thanks for doing this call today. Governor, the May 12th special election's a couple weeks out. Can you give an update on where you stand with your comfort level with having that as is? Will you push for any changes? And related to that, do we have an updated number on how many cases were related to the April 7th election? And are we now past the point of really worrying about that, given how far out that is?
Somebody also have to answer that last question. The first question is the election date is May 12th. We've spent a lot of time communicating with municipal officials across the state of Wisconsin. We sent a letter to the Elections Board encouraging them to make sure that they're connecting with those folks to make sure that everything can happen in a safe way.
But as to the number related to the April 7th election, we do have 52 folks in Wisconsin who reported who have tested positive for COVID-19 who were either a poll worker or voted in person on Election Day. As we've said all along, their exposure may have been from something else they did that day, but as we've been tracking this and folks have been answering this question, these 52 folks did indicate they were either a poll worker or voted in person on Election Day. We will continue for 30 days, so until May 7th, with that as part of the contact tracing interview, but believe that after the 30 days, it is not a necessary question related to April 7th anymore. And I suspect that the vast majority of the cases we will determine or that we will hear about from in-person voting have also already likely come to the surface.
And I think this is Ryan Nilsestuen. One other thing just to add about that in terms of how the administration has been responding to this. Just like with the spring election, the State Emergency Operations Center is working very closely with the Wisconsin Elections Commission and clerks throughout the state in order to provide personal protective equipment for poll workers, provide tape to be able to demarcate how 6 feet between people showing up for in-person voting, providing cleaning supplies and other support. We're also, just like we did with the spring election, making sure that there's enough poll workers so that we don't have to have unnecessary consolidations at polls, which causes more people to congregate in a single place. So safety is definitely foremost at our mind with this, but I think by having additional time in order to prepare, working closely with the Wisconsin Elections Commission, as the governor indicated, being in close contact with them, And then also, again, as we said with the spring election, and it's very important here too, the safest way that people can vote is by absentee ballot, and they can request a ballot today by going to myvote.wi.gov and requesting their absentee ballot. And that's the best way that people can participate in our democracy. Folks up north can choose who represents them in the U.S. House of Representatives and do so in a safe manner.
Thank you, Scott. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking the call. Governor Ebers, you announced a cut in state spending today that's kind of associated with the pandemic. Can you kind of just address the reasons behind that and just kind of address that cut?
Well, certainly, as other businesses and governments around the state, issues around revenue is very important, and so this is a first step. Since this pandemic started, we made some changes procedurally in state government around hiring and not hiring folks, and making sure that travel is restricted in the most significant way. And so these things are important. We think it's one of our ways to get to a better place financially. Cutting the operations budgets by 5% is approximately $70 million in savings, which is important for us as a government going forward.
Thank you, Casey. Now to either Danny or Emily from WKOW-TV in Madison. WKOW?
Hi, my question is for DHS. We are seeing more drive-through testing sites popping up across the state. For example, Sauk County today is testing the general public with anyone who has symptoms of COVID-19, or even if they just feel ill. When do you think this will be expanded, and what's preventing it from happening statewide?
So, Emily, it is absolutely an important part of a testing strategy in which you're working to get community-wide testing at a rate that allows you to really understand the prevalence of the disease in the state of Wisconsin. So we've been working with a variety of local public health departments and health systems across the state to expand the number and the use of community testing sites, whether it's drive-through or otherwise, to increase, as we've expanded our guidelines for testing, we need to expand the options and the ways that people can get tested. And so we're anxious to see more of those across the state, and we are actively, as I mentioned, working with a number of counties and local public health and healthcare systems around the state to do more of this kind of testing.
Thank you, Emily. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Hi, I wanted to ask about the reductions in state spending as well. Do you, as the universities are doing some furloughs, do you anticipate doing furloughs at any point? And what do you think of the idea of freezing state spending in the next fiscal year as Voss has proposed?
I didn't quite catch the very end of that, Patrick, but I think you asked about how the budget looks next year, basically, and it's going to be difficult. Certainly, we're hopeful that the federal government will help us along with that, and they're considering it at this point in time. But we're not wasting time. We're taking care of what we can take care of now, and that's the operations piece of the budget. And going forward, we'll be continuing to make difficult decisions.
Thank you, Patrick. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. This question is for Secretary Palm. Secretary, near the time of the first safer at home order, you said DHS models predicted between 440 and 1,500 deaths by April 8th without Safer at Home. Safer at Home has been in place for a little bit over a month now, and our number of deaths is obviously significantly below that range. Mm-hmm. I'm curious, what do the DHS models say now about the range of number of deaths Wisconsin might see all told?
Mm-hmm. So I think, Ben, it's important. There are a couple of clarifications. I think one, we projected the 22,000 infections by April 8th, and that would result in 440 to 1,500 deaths, and those deaths would not necessarily occur by April 8th, right? Because those folks infected by then those deaths would ultimately come from those 22,000 infections. But I think, right, the bigger point is that Safer at Home was designed to never allow that to happen, which is why we believe that Safer at Home, this is the evidence that Safer at Home is working. And so we continue to work with models to help us understand worst case scenarios, to inform the strategies we need to put in place to help us, again, continue to make sure that these worst case scenarios don't happen. The modeling we've done most recently, which is also available on the website, was looking at the dates upon which you would stop Safer at Home and the subsequent surge that would happen as a result. And it outlines a number of scenarios, including one in which we continued Safer at Home and accelerated and built up our tracking, our contact tracing and testing capacity. And what that model showed us was that with vigorous testing and tracing, we will be able to stay below the capacity of our healthcare systems. And so that was a really important input in our decision to extend Safer at Home and to develop these plans through Badger Bounce Back to scale up testing to 85,000 tests a week and to hire 1,000 contact tracers, again, to help us really do that aggressive hand-to-hand combat on the ground to stop the spread of this disease on an ongoing basis when we have more interaction among people as we continue to turn the dial.
Thank you, Ben. Now to Jessica Van Egren from Up North News. Jessica? Jessica Van Egren? And a reminder, *6 to unmute your phones. Jessica? Okay, we'll move on then to Mason Dowling from WAOW-TV in Wausau. Mason? Mason Dowling from WAOW.
Hi, can you hear me now?
Yes,
Yep.
we can.
Okay, perfect. This question is for the governor. Governor Ebers, yesterday there was the push from yourself, the DHS, and the Department of Justice to ask the Supreme Court to throw out that case, the Republican lawsuit against the extension over Safer at Home. What do you make of all of this becoming such a fuss being brought into the state Supreme Court?
Well, first of all, as I said initially, solving the political differences on this, frankly, we proposed Safer at Home, and the response was ending up in the Supreme Court. So I'm not sure that's the best way to solve problems. But I will say that we have a good case if we believe in the facts and we believe in the law and we believe in precedents, we should win. And so we're relatively hopeful that we can move beyond this and move forward as a state. It benefits nobody, frankly. And we've had good support, great amicus briefs by different groups of people across the state that understand the importance of Safe at Home, understand the importance of contact tracing, the importance of testing, and also the importance, as we are trying to do now, of turning the dial when we can to open up the economy. So we feel confident in what we're doing and in the lawsuit also.
Thank you, Mason. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hey, can you guys hear me?
Mm-hmm. Yes.
Thank you. So you guys have reported that hundreds of employees, I can't remember the exact number off the top of my head, have been transferred within Department of Workforce Development to help answer calls and on over the overloaded phone lines. What else are you guys doing to make sure unemployment is received in a timely fashion other than that switch over? I know that New York has set up an online system to deal with errors rather than having phone calls. Is anything like that planned here? Or what else is being done besides the new call center that's going to be up in a couple of weeks?
I think I gathered the question. So I think the question was asking what's being done at DWD in order to address the unprecedented number of claims that they filed. And as the reporter mentioned, DWD has been hiring. We've been transferring employees from other agencies to be able to fill in. DWD also did a significant technology upgrade to be able to handle a significantly larger number of callers, and that helped a lot in terms of making sure that people weren't being dropped and that they were able to answer more calls. And there's going to continue to be those types of technology upgrades, additional employees, and streamlining processes. And I think the other thing that's important to realize with this is, one, in terms of the unprecedented number of claims that they had to handle in a short period of time. It was a significant challenge. They're dealing with outdated technology, and they've done while there are people who, we want to make sure that everybody is able to get through and is able to get their unemployment check, insurance check. Their DWD is working around the clock to make sure that those call times are better, that more checks are going out, and that they're handling the situation in a prompt manner.
Thank you, Adam. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for taking my call. I was wondering, I've heard from one of the long-term care associations in the state that they'd like to see COVID testing of patients leaving the hospital and being admitted to nursing homes, even if the patients aren't symptomatic. And also maybe more wide-scale testing of admissions to nursing homes. Is that something the department supports? And have you had any concerns about that transfer process of patients leaving the hospital and moving to a nursing home? Thank you.
Thanks, John. We are currently, through an advisory committee, looking at this very question because there are a variety of opinions about these transitions and these transfers between hospital and nursing home, which can go in both directions. And so we've got some experts looking and talking through those issues right now and expect some recommendations from them shortly.
Thank you, Sean. Now to Victor from CBS 58 in Milwaukee. Victor? CBS 58.
Sorry, hi, can you hear me now?
Yes, we can.
Okay, good. Yeah, sorry, I had on mute. Thank you again for taking the call. One of the hotspots in the state has been in meatpacking plants. And President Trump recently said that those plants are vital to the food supply and that they should remain open. However, as we've seen, those have been kind of some hotspots for cases here in Wisconsin. I just wanted to get a general sense of is the state, the Department of Health Services, taking any additional steps, any more approaches to address these specific cases of these meatpacking plants, and kind of tied to that, a lot of minorities are essentially the labor force for these meatpacking plants, and I'm wondering if there's any additional resources or outreach to these communities since they are largely affected in this industry.
Yeah, and I'll start out, Victor, and I know Andrea probably will have some specifics, but the bottom line is we have several surges of positive virus tests happening in several food processing plants across the state of Wisconsin. Obviously, Green Bay is a good example where we have, I think, up to 500 employees in a couple different institutions that have the virus. We are doing everything in our power to get every one of those employees in all the plants all across the state, frankly, to be tested. and also making sure that we do it in a culturally appropriate way, and because we're going to also need to test families and others through the contact tracing that we talk about. So this is a good opportunity for us to expand our testing. Unfortunately, it's taken a situation like this to make that happen. But it is important that we all realize that, yes, and the President's outreach on this issue, order on this issue is important for making sure that our supply chain is good and make sure that we have good, nutritious meals. But at the other side of the story, we also have to make sure that our workers are healthy. And I don't think one can happen without the other. And so our goal is to be as cooperative as possible, but we do need to get those workers tested and their families tested. And because English isn't always the first language of the people that are in these situations, we need to make sure that things are done appropriately, culturally competently, and we have a group, we have a surge of people working on that right now.
That was good. Thank you, Victor. Now to Addie Bank from WFRB TV in Green Bay. Addie?
Hi, can you hear me?
Yes.
Yep.
So, Secretary Palm, earlier when the pandemic really started, Wisconsin was really concerned about getting PPE into the state for our healthcare workers. Where are we now with that demand on PPE?
So it's an ongoing demand, because as you are treating patients, you're burning through your supplies, and so you need to replenish those. And so the shortage we have had since the beginning continues, and we continue to work on a number of fronts to satisfy our need for supplies. We continue to press our federal partners through FEMA. We continue to work through our donation and buyback program, as well as our own aggressive procurement to bring more supplies into the state for distribution. In fact, we will begin a distribution to counties for further distribution to local healthcare providers, facilities, and local public safety tomorrow. And those supplies came in through procurement and buyback, and so we are anxious to get those distributed over the coming days, and we'll continue to do that as we work to press, again, our federal partners, as well as our efforts to continue to purchase more of the supplies that we need to push out to our frontline healthcare workers and our public safety.
Thank you, Addie. Now to Adam Duxter from News 3 WISC in Madison. Adam?
Hey guys, can you hear me?
Yes.
All right, my question is about the 187 facilities that we're talking about here where we've seen outbreaks. My question is, what is the state doing to try and catch these outbreaks early before they spread? Mm-hmm. And then kind of going off Victor's question, but how big of a concern is the state food supply chain right now? I know that the chairman for Tyson had some statements about the national supply chain the other day, and I was curious how we're thinking about it here in Wisconsin.
You can answer the first question.
Okay.
I'll answer the second.
All right.
This is a twofer.
So on the outbreaks, right? It is workplaces, which is what you're alluding to with the supply chain issues, but it is a variety of settings, and they are important to be tracking on a positive case basis, as few as a single positive case, because these are vulnerable populations. They are living in close quarters, and so the potential for spread is increased. And so we are focused on wrapping around them as quickly as possible. We have also done a lot of work, particularly with long-term care and our partners at DOC and the corrections facilities about infection prevention, about the kind of work that needs to happen in these kinds of congregate living situations to reduce the spread of disease more broadly, right? Whether it's flu season, or whether it's this pandemic, or whether it's other kinds of infectious diseases, these congregate settings are more likely to see spread. And so the kinds of infection control practices that you need to have in place are there in these places. And so doubling down on them, enhancing training, reminding folks, upping our game on those practices is a really important thing. And we are doing regular webinars and outreach and additional trainings and reminders to folks to help them make sure that they are implementing these kind of prevention practices in a really vigilant way. But I do think, from that perspective, it is why in long-term care, very particularly because they are a vulnerable population, we have known that from the very beginning of this outbreak, that older folks and folks with underlying health conditions are at greatest risk for severe disease. It is why one case is enough for us to wrap around that facility to make sure we are in very close contact with local public health, to make sure they have what they need to do an investigation that ensures we stop the spread as quickly as possible. And so, for example, in the 93 long-term care facilities that are part of that 187, 20 of those have a single confirmed case, where 25 of them have fewer than 5. And so about half of them have under 5 cases. But it's really important for us to be vigilant and watching them very closely and acting urgently to reduce the spread in those settings. And that is why we have really bulked up and stood up our focus on outbreaks, so that we are doing everything we can to stop the spread.
Question number 2, yes, we are concerned about the finding processors for both the hog farmers of the state and the cattlemen and frankly dairy producers in the state. In the dairy industry, for example, people are culling their herds because certainly there's an oversupply of milk, and so there needs to be a market for those animals. In the hog market, the same thing. As these large plants become have difficulty with the number of workers that are ill, and making the changes that are necessary to move them forward in a positive way. Our Department of Agriculture is trying to find other producers or other processors, and that's what they're doing 24/7 to find processors that can take the animals that are in the chain, in the process of going from farm to processing plants.
Thank you, Adam. Now to Mark Halverson from WWIB Radio in Chippewa Falls. Mark?
Yes, thank you. Governor Ebers, I know a haircut may seem like a small matter, but it's something that affects nearly everyone in the state, not to mention the thousands who are gainfully employed in this field. I hear many talking about how badly they need a haircut, their kids, or those talking about needing a hair coloring. What can you tell us about how you and your staff have navigated this challenge of not using personal care professionals? Thank you.
Just get up every day and comb your hair. I don't know what else to say. That's what I do. I haven't been to a stylist or barber in months and months, probably well before the pandemic. So wash my hair every day, comb it, and go to work.
Thank you, Mark. Now to Melanie Conklin from the Wisconsin Examiner. Mel?
Good afternoon, Governor. I'm not sure how to top that last question.
Or the answer.
But you began the call. You began the call today contrasting work that's happening in Ohio and Minnesota with the current Supreme Court lawsuit over the extension of Safer at Home here. This is just the latest example of something of a balance of power struggle that involves legislative and executive branches that go back, it's been almost a year and a half to the lame duck session that occurred before you took office. Would you speak just a little bit to how these conflicts have impacted you governing, as well as the citizens of Wisconsin and you personally?
Yeah, and I'm sure if you ask Speaker Voss or Majority Leader Fitzgerald, they'd probably answer the same way. It's not productive. And in the days of bipartisanship, certainly there was some advantage for them in the past because they had a Republican governor. It's easy to be getting along then. But at the end of the day, we do need to, and this is a national issue. I guess I don't want to put it in the context of only Wisconsin, but I do see other states with Republican governors. I know Governor DeWine, he does a great job. They work hard at what they're doing. They have support by both sides of the aisle. Obviously not every individual there, but they're generally speaking, that happens. The same thing in Minnesota. So we can make that happen. I don't think running the Supreme Court is necessarily the best way to resolve these problems, but that's where we're at, and I believe we can win this case. My door is open. I said this morning. Somebody asked me a similar question, and we developed a plan and began implementing it, and we went to court, and we were sued directly to the Supreme Court. I'm willing to talk to either one of them. If they have a plan, let's talk about it.
Thank you, Melanie. Now to Cammie Rapson from WBAY-TV in Green Bay. Cammie?
Good afternoon. Voces de la Frontera copied the governor's office and DHS on a communication on April 13th about concerns that workers had at one of the meatpacking plants in Brown County. Voces told us this week that in a follow-up meeting with the governor's office, they were told it was OSHA's jurisdiction, not the state. Governor and Secretary Palm, are you willing to publicly voice minimum expectations for any plant or factory operating in Wisconsin? If so, what are those expectations for the employees? How do you communicate them, and how are you enforcing them? Thank you.
Well, that goes back to your first, that last part of the question goes back to the very first answer, and that is enforcement is done by OSHA. It's not done by the Department of Health Services or any other department in state government. So we are more than willing to provide guidance, and we continue to do so, as does the CDC, who is on board in Green Bay, and possibly some of the other places in the state. But there are the things that are good common sense for us that are safer at home are good common sense for any processing plant or any business in the state, any home in the state. Physical distancing, making sure that the people are doing the hygiene that they need. I was just listening to the White House conversation on this morning or at noon today with governors from Nebraska, where they did have problems in plants, and they worked with them to do common things, and just as I mentioned, plus areas where people take breaks to make sure that those distancing things happen there. It takes a lot of work to keep physical distance, and we're more than willing to help any business in the state on those issues.
Okay. Thank you, Cammie. Now to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my question. And I'd like to follow up on the question about the relationship or lack thereof between the governor and the legislative leaders. I'm from a part of the state where both the senator and all of the representatives are Republicans. So I guess my question is it your position that the legislature needs to come to you for the working on a bipartisan basis, or what is it that you're willing to compromise on that might attract them to compromise?
Well, I guess I'm not in the business of negotiating over the media. I'd like to sit down and talk with them. But see, I don't think we're that far apart. I mean, all of us want this state to be safe. All of us want the business community to open as soon and as safely as they can. So I don't think the broad parameters are of significant difference. It's around the details, and if they have a plan, I threw my plan out there, they can, and we're implementing it. If they have a plan, let's talk about it. That's how negotiations work. I've negotiated when I was a teacher and when I was an administrator on both sides of the aisle. You come in with some proposals and you hash it out. Hashing it out in the Supreme Court isn't particularly helpful unless you're a lawyer making money off it.
Thank you, Steve. Now to Amy DuPont from Fox 6 in Milwaukee. Amy? Fox 6 in Milwaukee? Okay, we'll move on then to Caroline Peterson at NBC 15 in Madison. Caroline? And a reminder, star 6 to unmute your phone. Caroline Peterson from NBC 15. Okay, we'll move on then to Denise Lockwood from Racine County Eye. Denise?
Hi. I had a question with regards to, like, when someone tests positive for COVID-19 and works at an essential business, what onus do workplaces have in offering, like, PPE, like masks and things along that line to workers who work at essential businesses? And is that being enforced, and will that be reported out?
So this is Ryan Westergaard with the Division of Public Health. If someone does test positive for COVID-19, whether they're working in essential business or not, the recommendation from public health, and there's broad consensus about this, is that they need to be in isolation during the time that they are infectious, which is usually at least a week or two. So there's really only in a crisis, like if there's a healthcare workforce that can't do it, do we allow people to go to work at all if they test positive, meaning they have the infection and could spread it to others. Now, I think there's a broad place and probably a lot of areas we can do better using infection control measures in a whole range of workplaces in the future. And I think as the supply picks up of PPE and we make sure that healthcare systems are replete with everything that they need, and we figure out other things about alternative face coverings and other things, I think there's going to be a lot more of a place for those kinds of things in the general population. But I think the core message is people that are sick with COVID-19 definitely need to be in isolation, shouldn't be working at all. And as time goes on, people and more people go back to work. Really anyone who with any respiratory symptoms should be staying home from work and trying to work with their providers about whether to be tested. That's really the most important thing for preventing the spread in communities, is making sure that people that have symptoms are out of contact, are physically distant from other people.
Thank you, Denise. Now to Ryan Burke from Spectrum News 1. Ryan?
Good afternoon. Different states are beginning to discuss plans for what it will look like when schools open next year. Some, including California, have alluded to things like possibly starting the school year early or doing split shifts when it comes to having students come in for half the day. What options, if any, is Wisconsin considering at this point when it comes to planning for the school year ahead?
Well, we're working with the Department of Public Instruction and the state superintendent on a regular basis discussing that. Clearly, it's a ways out, but we want to make sure that we're focusing right now on testing and on contact tracing. But we are looking at the fall. Certainly, we hope that school will open on time, and our students are in a position where they feel safe, their parents feel safe, or feel that they are safe, and we can move forward during the school year. But we're several months off from that, and so I don't want to say this is how it's going to happen. But those discussions are happening on a regular basis, not only here, but I know school districts across the state.
Thank you, Ryan. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Hello. I'm interested in hearing your thoughts on Freighter's and the Medical College of Wisconsin being granted access to treat COVID patients with that antiviral medication remdesivir. Have you heard much about that drug and its hopes or promises?
Yeah, it's Dr. Westergaard again. I can speak to that. So remdesivir is not FDA approved, and the reason is because it's still investigational status. So trials are ongoing to find out whether it is effective at reducing or at improving outcomes, reducing deaths, or speeding recovery in patients compared to placebo or standard of care. So we don't have those data to be confident that it's an effective drug, but based on its mechanism of action and similar drugs, there's always reason to be hopeful and reason to suspect. So often when drugs are in this investigational status, but they are promising, the FDA will grant permission to use, or they call it a compassionate use basis for patients that might be beneficial. So there's really for a drug that's not approved, those are really the two pathways. One is that participating in a clinical trial, understanding that it's not an accepted standard of care, but it shows promise. And number two is under those specific circumstances where the FDA has granted compassionate use.
Thank you, Rachel. Now to Maddie Heim from USA Today Network. Maddie?
Hi, thanks for taking this call. I'm just curious whether DHS has offered any guidance to health departments about when they're entering deaths into the surveillance system, whether they should enter those deaths in cases where there was no test, but the death is deemed a probable case of COVID.
Yes, I believe we have. So both of those things are reportable, probable cases, meaning suspicious symptoms and a known epidemiologic link, so a known case, and deaths believed to be associated with COVID-19 with or without testing.
Thank you, Maddie. Now to Emily Files from Milwaukee Public Radio. Emily?
Hi, thanks for taking my question. I want to go back to the 93 long-term care facilities that are identified as having a COVID outbreak. You said the region where those facilities are located will be identified on this new dashboard. Will the names of those facilities also be available? And if not, why not?
So we do want to provide as much information as we can, obviously, to help folks understand the status of the pandemic in Wisconsin, but predominantly, right, to advance the public health. And as we have previously not given information that would identify an individual case and where they live, long-term care facilities are people's residents, and so we are interested in protecting the privacy of the residents of those facilities. CMS recently issued a requirement for additional reporting from long-term care facilities, and so that may, as that moves forward, provide opportunity for additional information to be released. But we want to make sure that we are being as transparent as we can without exposing individuals and their privacy in a way that does not advance the public health.
Thank you, Emily. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. In regard to the 5% cut among state departments, I was wondering if you might be able to share any sort of fiscal information or revenue estimates that the administration has been working with in regards to that cut. And then also along those lines, is it up to individual departments on making certain cuts, or are there guidelines that they're being asked to follow to achieve that goal?
I believe that the information we've sent out has suggestions, but having been through this as a department head for several years, there's always that flexibility. Obviously, different departments have different needs, and so we will respect that. We estimated not too long ago that revenue shortfall this next budget would be probably, or the next year, fiscal year, would be approximately $2 billion.
Thank you, Mitchell. Now to Abigail Hentke from NBC 26 in Green Bay. Abigail?
Hi, thank you for taking my question. Just taking a look back at Brown County specifically, because we're kind of a hot spot right now for rate of infection. Looking at the hundreds of meat plant employees that have tested positive, do you know if they are just being required to self-isolate in their homes? If not, is there going to be maybe an isolation center set up to kind of break this chain of infection?
So those folks through contact tracing are isolating. There are currently 2 isolation facilities that Brown County and the partners there have established and are available for use by these families and obviously others in the community. So they do have isolation capacity in Brown County, but we do expect that anyone who has tested positive, as Dr. Westergaard said earlier, that they are isolating and out of circulation from work and from contact with other people.
Thank you, Abigail. Now to Andy from WISN TV in Milwaukee. Andy?
Yes, thank you. There are now some stores who are mandating that you wear a mask in order to go inside, such as Costco and Menards. Both are doing that now. Is there any thought to making masks a requirement, much like Illinois and Michigan have done, that everyone has to wear a mask out in public?
I know we've talked about that. I guess that's still under discussion, but I think it's admirable that these 2 stores have done that. Clearly, they're both large stores and large number of people going in there. And not only do we hope that the mask piece goes into place, but also, frankly, lots of distancing issues too. And so it's really important that no matter the size of the business, that we have that physical distancing. It's critically important.
Thank you. Now to Stephanie Hoff from WisPolitics. Stephanie? Stephanie Hoff from WisPolitics.
Hi, yes, my question is for Governor Evers. Governor, will there be furloughs of state employees?
I'm not able to say that at this time. We're working hard to get this 5% piece done. As we go forward, we will take a look at everything, and it relates to our budget and the revenues that are there.
Thank you, Stephanie. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
Question for the Secretary and possibly Dr. Westergaard. When looking at the positive percentage rate, the goal is for it to be on a downward trend. Is there a target percentage people should be looking at for implementing phase 1 of the Badger Bounce Back Plan?
Yeah, I would say the trend is the important thing. With all the data that we've collected with regards to every aspect of the epidemic, there's day-to-day variability and sort of small trends up or down. So we want to see sort of a sustained going in the right direction. And we've been pretty flat between 9 and 11%. So that varies a little bit day to day. But the idea of looking at a trend is that we feel comfortable that overall we're in a better place than we were a week or two ago. So what is the precise number? Well, it depends on how widely we can do testing. If the actual amount of transmission in the community goes down from where it is now, and we double how many tests we're doing on a regular basis, we'll see that percent go, by 50% lower or even more. So we would like to see that. There's not clearly a one threshold of what the percent is that we would feel comfortable going better, but that tells us an important thing, both in regards of are we testing enough people to make sure we're not missing people, and is the actual epidemic, the number of people truly becoming infected, regardless of testing, going in the right direction. So the short answer is we want it to be better than it is now and sustain going in that direction.
And I just want to, and thanks, Dr. Westergaard, I just want to, just an overall pitch, anybody that needs a test in the state of Wisconsin should be able to get a test. And we really need our healthcare partners across the state to help us with that. To get those numbers to the point where a trend line can be established in a reasonable way, and also help us get our contact tracing people working to solve this problem. We need to have a massive increase in tests, and one of the only ways we're going to get that is if we get our healthcare providers and partners all across the state of Wisconsin getting their patients tests.
Thank you, Jeremy. And our final question this afternoon belongs to Jonah Chester from WORT Radio in Madison. Jonah.
Hi, thank you for taking my question. My question is for Secretary Palm. Earlier today, a federal Democratic leadership introduced legislation to federalize the medical supply chain due to shortages of PPE and testing kits, as well as a general lack of oversight. In light of that move, what's the current state of Wisconsin's testing kit supply?
So we, in setting our 85,000 goal, we did a number of things to help make sure that Wisconsin would be able to achieve that goal, and those included a couple of contracts, one with Exact Sciences to provide at least 20,000 kits a week to the state of Wisconsin, as well as a partnership and a contract with Marshfield Clinic to start at 10,000 tests a week and go from there. And so that, in addition to the clinical lab network that we have, we feel good about our ability to get to 85,000 tests a week. We also, through our procurement efforts in our statewide response at the SEOC, are working to purchase Thermo Fisher kits and Genturi supplies, swabs, other types of pieces of the ingredients for this testing to try to help take some of the supply chain pressure off of our needs here in the state of Wisconsin. But it is true that we do continue to compete with other states around the country, and that our ability to do that in a way that is effective and that ensures that Wisconsin will have what it needs is hindered by the fact that we are all competing against each other. And so we will continue. It will continue to be a priority for us. We will continue to look to secure supplies so that we are able to do the widespread testing that is necessary. But some of these supply chain issues, absent a coordinated federal effort, certainly could be hampered.
Thank you, Jonah, and thank you for joining today's media briefing. Please continue to monitor the DHS Outbreaks and Investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, you can visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. Thank you, and have a good afternoon.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate, WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.